Welcome to the 6th Do Good Challenge. My name is Bob Grimm, and it's my honor to be the director of the Do Good Institute, which was launched earlier this school year when the University of Maryland became the nation's first Do Good campus. It's already been an exciting year for Do Good at the University of Maryland. Earlier this year, the UN Secretary General came to campus and called on the nation's youth to become a do good generation. And earlier this year, Senator Van Hollen and President Lowe and Policy School Dean Bob Orr packaged the millionth meal for Do Good Challenge winner Terps Against Hunger, who won last year. And we're just getting started. With the Do Good campus, we're going to engage every student in experiences from orientation, first-year experiences, all the way through graduation. And once they're inspired to make an impact on a cause they care about, we're working to develop partnerships and collaborations with every school and college here in College Park. And to top that, we also have launched a new undergraduate major in public policy with a focus on social innovation and nonprofit leadership. And we've also developing a minor, and next year we'll develop a Do Good accelerator to scale up some of the promising ventures and projects that you're going to see tonight. But I also forgot one thing that happened just a couple months ago. A couple months ago, Evan Lutz, a Maryland alum, who started the company Hungry Harvest, located right here in Maryland, became the second Do Good Challenge alum in 3 years to be named by Forbes as one of the top 30 social entrepreneurs under 30. The new Do Good campus is going to create leaders like Evan, who are driving innovations and impacts right here in Maryland and transforming lives in Maryland and around the world. It is really the essence of the Do Good campus, and the University of Maryland is redefining higher education in the 21st century. And it is my privilege to introduce and bring to the stage the individual who has been personally committed, developed the vision, and has made Maryland the destination if you want to do good. Please welcome to the stage President Wallace Lowe.
Thank you, Dr. Grimm, for your leadership. And hello, Terps. Are you fired up for the 2017 Do Good Challenge? All right. So when I raise my arm, I want you to yell as loudly as you can to make the walls of this theater tremble. Yell, do good. All right? When we serve the community and give back, when we raise funds for important causes, we are the University of Maryland, we are Terps, and we all right. I want to recognize a couple of distinguished guests that we have here tonight. We have the President of the Maryland State Senate, Senator, where is he? Mike Miller. I can't see you, but there he is. And we also have another senator. I don't know where he's seated, but Rich Madaleno. Thank you for being here. Many people make this event possible. Many people have contributed to the creation of the Do Good Challenge and the Do Good Institute that will make for a Do Good University and eventually a Do Good world. But I do want to single out the principal co-sponsor of the Do Good Challenge for the past 5 years, Morgan Stanley. Thank you so much for your support. Let me just briefly comment. I think it was Winston Churchill who once said that you make a living by what you get, but you make a life by what you give. There is enormous truth in that, because somebody else, back in the middle of the 19th century, around 1840, a French nobleman, he wandered around America, and he wrote this classic called Democracy in America, Alexis de Tocqueville. And he said that the key to American democracy, what makes democracy work, is that individuals come together, help one another, make a difference in their communities. You see, his great insight was that the character of American society is shaped not only by what government does, but what individuals like you do on behalf of others. That is American citizenship in action. That is what makes democracy work. That is the rent that we pay to live in a free society. But this turning of passion into compassion to serve others is not inborn. It has to be learned. That's why we have the Do Good Institute. Because at the end of the day, when you are here at the University of Maryland, at the end of the day, what counts is not your knowledge and your skills only. It is how you apply your knowledge and your skills and your talents to the causes of social justice and compassion and service in a world that's greatly in need of these blessings. Because, young Terps, at the end of the day, what counts is not your knowledge and your skills, it's your values and the content of your character. And that is why we have the Do Good Institute, we have the Do Good Challenge. I come to a lot of student events, and I must say that the Do Good Challenge is the one I really look forward to because it is so inspiring, and it brings out the best in us. And so to all the finalists and all those who are not finalists but participated, and I think there were, 60 or so groups that participated, thank you for your engagement. And again, we are Terps. We're at the University of Maryland. Thank you.
And now it's my pleasure to introduce our three distinguished judges. Our first judge is Cherise Clark. She's the managing director at Morgan Stanley. She leads their North America relationship lending. She's involved in a number of do-good efforts. I want to highlight one of them, Free From, an organization that promotes economic justice and opportunity for domestic abuse survivors. Cherise also is part of Morgan Stanley's 5-year support and commitment to the Do Good Challenge. Please welcome Cherise Clark. Our second judge is no stranger to the Do Good Challenge stage. She is Kirsten Kraft. She's the program manager for experiential learning at the Center for Social Value Creation at the University of Maryland's Robert H. Smith School of Business. I haven't stopped. I'm still going, my friends. In 2005, she was part of a team called Press Uncuffed that developed an advocacy effort that's been credited with helping free multiple journalists abroad. Please welcome Kirsten Kraft. And our third judge is Raj Vinakota. Raj is the Executive Vice President of the Aspen Institute's Youth and Engagement Division. He is a decorated and award-winning social entrepreneur. He was CEO of the Seed Foundation. He created the Seed School, and he's received praise from everyone from Oprah Winfrey to being featured on the documentary Waiting for Superman. Please welcome Raj Vinakota.
Thank you.
Now I'd like to take a moment to thank a number of our guests, sponsors, and partners. I want to reiterate President Lowe's comment that we are so privileged, and in fact, it is a highlight of the Do Good year that Senator Miller and Senator Mandolino are here with us tonight. And I also want to recognize that we have numerous members, distinguished guests from Governor Hogan's administration also with us tonight. I also want to thank Morgan Stanley Private Wealth Management for their 5-year support of the Do Good Challenge. And I want to particularly thank Michael O'Neill, who's, without his steadfast support of doing good here at the University of Maryland, the challenge would not be possible. Just so you know, I have a few more thank yous. I want to also thank Bob Orr. He's the Dean of the School of Public Policy. The Do Good Institute is housed in the School of Public Policy. But even more, Bob Orr is a model of how to do good. Indeed, his work and leadership at the UN literally has improved the lives of everyone in the world. And it is his entrepreneurial leadership and support that has made the Do Good Campus and the Do Good Institute possible. So I'd like to thank Bob Orr. I also want to thank some additional sponsors who are important partners in the Do Good Challenge. The Smith School's Dingman Center for Entrepreneurship, led by Alana Fine, and the College of Behavioral and Social Sciences, led by Dean Ball, have been very important sponsors for the Do Good Challenge. And someone who's been with us from the beginning is Freed Photography. For all 6 years of the Do Good Challenge, they have provided exquisite photography. If you're looking for a photography company, you should look no further than Freed Photography. I also want to recognize, and you'll see up here, a group of individuals who have regularly coached a number of Do Good Challenge teams every Friday at the Dingman Center for Entrepreneurship. The coaching is so important for the quality of the projects and ventures that you're going to see tonight. And finally, the Do Good Challenge planning team. Without a group of students who are committed all year to making the Do Good Challenge possible, it wouldn't happen. So let's thank the Do Good Challenge planning team. And now, for those of you who've never been to a Do Good Challenge, hard to believe, but if it is true, here is the format. Each of our finalists will have 5 minutes to pitch their impact and their effort. Then our judges will have 4 minutes to ask questions and make comments. But you in the audience have a very important role as well. So take notes, because after all 6 finalists have pitched, you will get to vote for a $2,500 BSauce Be the Solution Audience Choice Award. So you also will be a judge tonight. And now, my friends, it's time for the main event. And a unique feature of the Do Good Challenge is that we have 2 tracks. One track is projects, efforts by students to create an impact for an existing cause or organization. And our first project tonight is preventing sexual assault. Please welcome to the stage Natalie Cabezas and Alana De Leon.
Hi, I'm Natalie Cabezas.
And I'm Alana De Leon. And I have something in common with so many of you here today. I am a survivor of sexual assault.
Please look on your right armrest. If you have a pink or blue sticky note, please stand and remain standing.
So look around. Those of you standing represent the 1 in 4 women and the 1 in 16 men who will be sexually assaulted during their time here at the University of Maryland. This can include unwanted touching, attempted rape, or like in my case, rape. To put that into perspective, that's over 4,000 University of Maryland students every single year.
Now, only if you have an X on your sticky note, please sit.
So to the many of you who have remained standing, you represent those survivors who have reported developing PTSD after their assault. This causes them to relive their experience over and over again and can have extremely negative impacts on their academic performance. In addition to PTSD, survivors also develop other mental conditions, including depression and anxiety, and could eventually lead to them dropping out, transferring to another university, or in some cases, taking their own life. Every student at the University of Maryland deserves the chance to pursue their education free from this horrifying experience. And that's why PSA is here today. Please take a seat.
We are Preventing Sexual Assault. We're a student organization dedicated to raising awareness for the prevalence of sexual assault through education and change implementation. We believe that education through meaningful events is at the forefront of prevention and will lead to a necessary shift in our society in the way that we speak about sexual violence. We are strong and we are unique because we're survivor-based.
This year, PSA was able to hold our second annual Occupy McKeldin on Monday, April 3rd. Held on the most public space on our campus, the McKeldin Mall, this event featured a 10-hour sit-in, over 20 co-sponsoring organizations, healing events, tables with resources, and so much more. For this event, PSA was able to raise over $9,000.
With only 13 executive board members and 6 committee members, we are proud to say that Occupy McKeldin had over 1,000 attendees and is the biggest sexual assault awareness event on University of Maryland's campus. Throughout the day, we had attendees write reflections. The reflections range from survivors sharing their stories with us to others thanking PSA for being their ally. Furthermore, one reflection stated that through listening and educating through listening at Occupy McKeldin, they had realized they had been raped. These 2 quotes really resonate with me because it makes me proud to be part of an organization that's so dedicated to raising awareness and that supports survivors. The first step in preventing sexual assault is educating our community on what sexual assault is.
In addition to Occupy McKeldin, PSA was able to hold our first Real Talk events this semester. They were focused on an open dialogue and a much-needed conversation surrounding this issue. Over 100 men and women came to these events to take this first necessary step in their education by contributing to this conversation. Through our efforts, PSA has gained national attention, with NBC Universal reaching out to us because they heard about our innovative events. Through this, they asked us to be featured in their special about campus sexual assault. So this event, Real Talk, will be featured this Sunday at 8 p.m. on NBC. This has the potential to reach up to 85 million households, and we hope that you all tune in.
In the past year, we have noticed a shift in the way that our campus is talking about sexual assault. We've seen a 64% increase in the number of reported sexual assaults, the SGA's Sexual Misconduct Prevention Committee, as well as the Sexual Prevention Task Force. While these are steps in the right directions, the statistics remain the same. It's still 1 in 4 women and 1 in 16 men. We need your help to change this.
So in this next year, PSA plans to expand our outreach and diversify our audience by reaching those students who are a part of the most vulnerable populations on this campus, including students in the LGBTQ community, as well as those minority students, those students who are victimized at much higher rates but are so often ignored in these conversations.
With the $5,000 from Do Good, we plan on reaching students before they get to college because students are at the highest risk of being sexually assaulted their first 3 months in university. We plan on doing this through outreach to local high schools as well as freshmen at orientation and males in high-risk communities. Through our partnership with NBC, we've also realized that there are limited student groups out there on other campuses doing this type of work. Therefore, we have made it a goal of ours to expand PSA nationwide. We've already expanded to the universities of Shady Grove, and we're so proud of this, but each expansion requires an investment and a cost that we need help with.
So much has been done in only 2 years, but there's still so much to do. So I'd like to leave you guys with one thing. I'd like you guys to promise us this, something that Lily Bernard, a friend and Bill Cosby survivor, said to us. She said, "Whoever you are, I want you to do something that we victims do involuntarily. We are drafted into this war on rape. enlist yourself into this war on rape. It takes the whole community to stop this. Thank you.
So thank you, Natalie and Alana, for that. That was an amazing presentation. Clearly, you have a passion for that, and I also thank you both for being so brave on taking on what is a very important issue.
Thank you.
Thank you.
As I think about scale, I'm very happy that you mentioned thinking about broadening and finding other ways to find organizations on other campuses. Can you talk a little bit more about the cost to expand per college campus, how much that costs per college campus, and how much infrastructure you need on those campuses?
Sure. So with PSA alone, we've only been in operation for 2 years, and we've had to raise over $20,000 for the events and outreach programs that we're trying to do. And we have a huge community to support us with this. And we recognize that some of the universities that we're reaching out to might be smaller, and they might not have this type of support. So they might not have a $20,000 budget for every single student group. However, we do recognize that we had a huge cost just starting up at this huge university. So.
Okay.
So I guess I'm curious about what that $20,000 cost goes to. So it sounds like you had 2 big events on campus. Could you break down those costs a little bit further?
Yeah, so last year we were fortunate enough to come in second place at the Do Good Challenge, and we won $1,500. As treasurer, I can say that $1,500 is the backbone of why we were able to put on events this fall and this spring. That supported our Slut Walk that we had in the fall and our Real Talks that we had these past months. Essentially, those costs are mainly for Occupy McKeldin, and with this prize money, we hope to reach out to other universities that have already shown that they have a passion for trying to raise awareness for sexual assault, and we want to say, hey, we understand it's hard to get started. This is what we've done, and here's something for you. Here is money for you to put on your first event so you can spread PSA on your campus.
Okay.
So thank you for that presentation, and I just want to reiterate just for being here. Tell me how you measure success as you go to new campuses. What outcomes are you trying to achieve in the short term, the medium term? Certainly in the long term, I understand what you're trying to achieve. But what about those steps in between?
Sure. So I guess we would really have to kind of look at what we've done and what's happened in these 2 years and kind of take that to other campuses. So for example, if their campus does have an Office of Civil Rights and Sexual Misconduct or something similar, looking at the reporting rates. That was something that we kind of noticed this year, although this office is so young. We did notice a spike in reporting, which we mentioned. We would also, something that this isn't quantitative, this is qualitative, but just having survivors being able to come to us and say, I've never talked about this before, but here I am at this event, or the survivor who said that they didn't know that they were raped, or those things that they are concrete examples of lives being changed.
Have you thought about, when you thought about education, obviously educating potential victims and making them aware of what the threats are, have you thought about also educating who would be potential attackers?
Yeah, so our name is Preventing Sexual Assault, and so we realized that the best way to answer your question is through Real Talks. It's an open dialogue of of scenarios that happen every day at parties, in dorms. It's not a one-way dialogue of like a lecture. It's an open dialogue between other students, and we believe that hopefully through survivors attending these events and through PSA executive members facilitating them, that we can educate males and females, and that's why it's one of our goals to reach all the diverse different populations on our campus.
Great. Thank you both so much.
Yeah, thank you.
Thank you.
Thank you.
Our second team in the project category is Terp Thon. Please welcome to the stage Bianca Fiore and Allison Herskovitz.
Hi, I'm Allison.
And I'm Bianca, and we are here with Terp Thon. So Terp Thon is the largest student-run philanthropy in the state of Maryland. In addition to raising funds through peer-to-peer fundraising, we spread awareness by uniting all aspects of our diverse campus under one cause. Terp Thon hosts events throughout the entire year, including our annual Fall Color Run, but our efforts really culminate in our 12-hour dance marathon, which is held on campus every March. So why do we do what we do all year round? Well, imagine being a parent walking your child down the halls of a hospital that will become your home for the next days, weeks, months, even years. Or imagine being a child who only has the childhood memories of pain, hardships, and struggle. There are so many families and so many children that go through the struggles of childhood illness every single day. Now raise your hand if you know someone who has been affected by childhood illness. If you look around, there's a good majority of us who have either directly or indirectly been affected by childhood illness at one point in our life. There are over 3 million children who enter a children's hospital every single year across the nation. And I want you to meet Jaywin, who is one of those children. When Jaywin was 11 years old, his family received the worst news they could hear, and that is that their son, their little brother, had osteosarcoma, a rare form of bone cancer. At 11 years old, Jaywin didn't know what it meant to have cancer. His family was scared. They were angry. They didn't know why this had happened to them. And treatment for osteosarcoma is not easy. Jaywin underwent 10 weeks of intensive chemotherapy, followed by a surgery that replaced part of his femur that was affected with the tumor with a titanium rod, meaning that Jaywin had to learn to walk all over again. And despite everything that Jaywin had gone through at just 11 years old, he considered himself to be the lucky one. Because thanks to Terp Thon, thanks to Children's National, Jaywin got to go home and say he survived cancer. And there are so many kids that fight cancer every single day and aren't that lucky. And this is where Miracle Network Dance Marathon comes in. Miracle Network Dance Marathon is a national movement of over 350 universities, all uniting students under one cause, and that is for the kids at their local Children's Miracle Network hospitals. So Terp Thon is the University of Maryland's Miracle Network Dance Marathon, and we directly benefit Children's National Health System in Washington, D.C. So to break down numbers a little bit, there are 62 children that enter a Children's Miracle Network hospital every single minute. In our own backyard, there are currently 273 kids in hospital beds, including 26 kids in the cancer unit fighting against cancer like Jaywin had. So this is where Terp Thon steps in.
With the help of our over 300 planning team members who are leaders not only in our planning team, but also in their other organizations on campus, our over 21 executive board members, we are able to unite our very diverse campus under our Do Good mission, helping us become one generation fighting for the next. One way that we are able to spread awareness about Terp Thon on campus is through our annual Color Run 5K, which we hold every fall. People who come to our 5K become inspired by our mission and ultimately register for our dance marathon to help us fundraise for the kids. In fact, this year at our dance marathon, we were able to engage just about 10% of our entire undergraduate community at our dance marathon, where we stand for 12 hours to represent a nurse's shift at Children's National. And with the help of these 3,000 Terrapins, in addition to the average of 10 donations they each received, we were able to raise a historic $1 million for the kids of Children's National. . And to make that $1 million even more special, that represents a 38% growth over our fundraising total last year. In addition, it makes us the youngest dance marathon to raise $1 million and the youngest dance marathon in the nationwide top 10. And as if that $1 million couldn't get any better, Terp Thon takes no money out of our fundraising total to finance our operations, which means that every penny of that $1,001,394.26 goes directly to Children's National to make a huge impact on the patient experience. So our funds go to Children's National to make sure that no patient is ever turned away from life-saving care because of an inability to pay. Some of our other funds also go towards funding programs that insurance doesn't usually cover, such as art therapy programs that really help patients express themselves and begin to digest what they're going through. The Do Good prize money would help us a lot in enhancing our fall event, our color run. As we continue to strive to grow every year, it's important that our events grow as well so that we can hit even more people and attract even more people to our mission. The more people we get to come to our color run means the more people that we have who turn around and come to our dance marathon and help us fundraise. And that means that we're able to raise even more money for the kids of Children's National to help even more kids grow up to be bigger, bolder, and stronger, and so that they can also grow up to be leaders in their own do-good communities. So Terp Thon and Children's National both helped Jaywin get better. Jaywin just celebrated being 5 years cancer-free. And because of the incredible impact that Terp Thon and Children's National has had on his life, Jaywin is thrilled to announce that he's going to be attending the University of Maryland as a freshman next year. Jaywin is so excited to be joining this community that cares so much about a cause that means so much to him, because we truly are a campus of do-good Terps who are for the kids. Thank you.
Amazing. I mean, if we can measure success and enthusiasm in the room, clearly you've been successful. Well, thank you both for that, Bianca and Allison, for leading us through that presentation. It was very good. One of my questions, though, for you as we think about, how we allocate these dollars is just really trying to understand what's the most profitable events for you. It sounds like you put on a number of events throughout the year. And so of that $1 million, how would you break out how much was raised from Color Run versus your 12-hour dance party versus other events?
So the color run would definitely be the way that we could make the largest impact year-round. Because as we mentioned, a lot of the people who come to our color run are inspired to turn around and fundraise for our dance marathon. So our color run, we do not receive SGA funding for that, which is how we fund our dance marathon. So that is a little bit more difficult for us to finance, which is why the Do Good funding would help us most there.
But how much can you give us a sense of how much the color run generates of your $1 million? Like, is it worth it for us to give you $5,000 for the color run?
Yes, I definitely think it would be worth it because of that chain reaction. But in addition, money-wise, it would probably be, once we even out what we bring in with ticket sales to cover those operations and netting out the operations, probably around $2,000. But I think the fact that the people who come to that turn around and fundraised over $91,000 of our total shows that this is such a huge chain reaction that is starting with this event that can only continue to grow.
Thank you.
All right, I'm going to push you on this a little bit further. Okay, so let's talk about however many people come to your color run. What is the percentage of color run participants that you convert into your next event?
That percentage is 36.
36? Okay. And then if you're plugging $5,000 into one event, what's that event going to look like? This sounds like an awesome race. I want to be there.
So that would be a great way for us to continue to expand the color run. So as we kind of talked about earlier, we have already hit so much of our campus community that in order to continue to engage even more people, we have to make a couple changes. So we would be able to use that money to make those changes to bring other events into our color run to further enhance it.
What would those changes be?
That's a good question.
Okay.
So that would be something that we would talk about with our executive board and our planning team to help totally solidify, but we would definitely further enhance the color run.
Okay.
So I think I figured out a financial model. You just recruit everyone from Children's Hospital to attend University of Maryland. I think the tuition term would make it all work, so congratulations. So if you assume for a moment that 3,000 of your cheering squad, which is all here in tonight's auditorium, is fairly easy cost of acquisition. And now it's going to cost you a little bit to get more. What do you think is your ceiling? Like, at what point is the cost just too much and not worth it on the return? 5,000, 6,000, 10,000?
I think for now, that would kind of just vary based on the capacity of where we hold our event. So right now, historically, we've held our event in a room that can hold 2,000 people. So right now, that would be a limit, but we can continue to move and grow to other places as we continue to grow. So there really is no stopping point.
So the constraint is space?
Yes.
So how about just put it in the stadium?
That's a good idea.
Okay. Good.
But that would also be more expensive, which would be another reason why we would need the do-good funding.
Tell me about the expense of the stadium.
So that I do not know exactly what that expense is because I haven't looked into it, but space for our dance marathon is one of our largest expenses associated with that.
Okay, thank you.
So we're out on time.
Okay.
I have an additional question. So you all have been around for a long, long time, right? I don't know how long. So I'm curious, if you get the $5,000, what % increase do you want to see in the total dollar raised? And then how many kids does that fund additionally?
So we haven't set our year-long goal yet, but typically dance marathons strive to achieve at least 20% growth over the years. So last year we were able to achieve 38% growth, so we are definitely shooting to continue to grow.
Does that number look the same or different with the Do Good Challenge?
Ideally, that would grow with the Do Good Challenge because we would have more resources to grow our events.
Thanks.
Thank you, ladies.
Now, before I introduce the last team in the project category, I want to remind you that there is a $5,000 prize for both the project category and in a little bit here we'll see the venture category. So the first place team in the project category will win $5,000, second prize $2,500, and third prize $1,000. And now it is my pleasure to introduce the third team for the project category, the Do Good Challenge, Vintage Voices. Please welcome to the stage, Becky Goodridge.
I see trees of green, red roses too. I see them bloom for me and you, and I think to myself, what a wonderful world. What a Wonderful World was one of the many songs that I used to sing to my grandfather. One night, I could tell he wasn't doing very well, so I decided to distract him with some of his favorite music. He was in a lot of pain, but his face calmed as he began to hear familiar, old music. At that moment that we shared, he was at peace. He knew these songs were significant to his life, and I'm sure they were still etched in his memory as he passed on the next day. Many of us have had moments like this, when music helped us make a connection. These moments are meaningful for everyone, but are especially powerful for senior citizens living in long-term care facilities. They're living in a new, unfamiliar environment and don't always get all the care or attention they deserve. The aging population is expected to vastly increase by the year 2040, from 1 in 7 people to 1 in 5 people. And with a growing population and more people to care for, this is what much of our senior healthcare system is reduced to. This is a typical daily medication dosage. We're improving medication so we can live longer, but what does that do for quality of life? What if there was a non-medical and less expensive way to provide treatment? What can we use to supplement, not substitute medicine, that will also improve quality of life? Music. Studies have shown that music improves symptoms associated with Alzheimer's, dementia, depression, and anxiety. In my grandparents' memory and honor, I founded Vintage Voices, a student organization that uses the power of music to improve quality of life for the elderly. So how do we do this? First, we sing for them. We sing oldies music, typically from the 1940s through 70s, and they sing, play, and dance along. We also chat with the residents afterwards, which gives them a chance to give back to the next generation. They share their stories and wisdom. And studies show that giving back to others reduces loneliness and creates positive changes in the brain. But what happens after we leave? We also donate iPods so they can listen to their favorite music anytime.
Fly me to the moon.
Fly me to the moon. Stars. Fly me. I think it sounds like Frank Sinatra.
Like on Jupiter and Mars. In other words.
So this little tiny thing is like a magic machine, right?
So as you can see, all of this is bringing joy to those currently in senior communities. But what about the future of senior healthcare? That's where our outreach comes in. We give senior citizens a voice on campus by encouraging students to care about the geriatric population in such a critical stage in their career decisions through 5-minute Geri Talks. This semester, we've given Geri Talks to 216 students. Additionally, between rehearsing, performing, and chatting with the residents, we've logged 586 volunteer hours at 7 homes just this year. And we fundraised enough to sponsor 55 residents with all the iPods and music they want. But how do we know that this actually makes a difference? We saw improvement across all of our quality measures of activity level, sociability, memory for distant past events, memory for music, and mood. So what exactly would we do with $5,000? $5,000 would enable us to sponsor 2.5 communities, or 400 residents, in becoming Music and Memory certified. Music and Memory is a national nonprofit that creates iPod programs just like this at senior living communities. Through this certification, staff would be trained to use the iPods if they don't already know how, load music on them, and collaborate with family members to find out residents' favorite music, which is especially important for residents with cognitive impairments who might not be able to tell them themselves. Because this is about more than just music. This is about Alzheimer's, dementia, anxiety, and depression. This is about real people, our grandparents, parents, friends, relatives, and maybe one day, even you and me. Because unlike other issues that may eventually be resolved, aging will always exist. But that doesn't mean it will always be a problem. With a little extra effort, we can make it joyful, harmonious, and filled with laughter, one vintage song at a time. Thank you.
So am I Christina Aguilera? Are you Simon?
I'm Simon.
Okay.
Yeah. Let's get this right.
I mean, I figured since we got the red table.
I got my sport coat and my dress shirt.
sang.
Right?
Yeah, okay, well, thank you very much for that. That was great, Becky. I guess my first question for you is just, how are you going to quantitatively measure success? So if you get $5,000, it sounds like you can give them more iPods. Have you talked to the doctors at the facilities to figure out a way to quantitatively measure success?
Sure. So Music and Memory does have some quality measures. In addition, one of the facilities that we've worked with in the past collects their own data on how the music impacts the residents, including listening time, whether they sing along, mood before and after, whether they clap their feet, dance, anything like that. And we also, if we were to sponsor homes in becoming Music and Memory certified, since we've been doing this for a while, we have some kind of formats that we would recommend for collecting data like that.
Thank you.
So I'm curious what your long-term goals are. So when you leave the university, do you take this with you? Does it stay here? What happens to Vintage Voices?
Sure. So we're a self-sustaining organization. We are SGA approved. And we elect an executive board every year, so after I graduate, it will still be there. As far as our long-term goals, we're looking to both deepen the impact of where we currently are and expand. So one way that we're looking to expand is we are looking into bringing it to other campuses. And we're also looking into obviously scaling our impact through sponsoring multiple homes and becoming music and memory certified. It only costs about $2,000 to sponsor a home and provide them with a starter kit. And then as far as deepening our impact, we want to continue spreading joy by singing and also donating iPods and really expand our Jerry Talk program so that we can make a longer term impact and reduce the stigma and give more students a positive perception of the elderly so that if they do end up eventually working with this population, they'll be that much better of a caregiver.
So Becky, I can't be Simon Cowell, I can't even keep a tune. Two-part question. What role do students play? Kind of talk me through that for a moment. The students, what role do students play in this project?
In all of it?
Mm-hmm.
So it is a completely student-run organization. As far as our relationship with Music and Memory, we're not currently affiliated with Music and Memory.
Mm-hmm.
If we were to sponsor a home, we would pay Music and Memory to come in and give them that training. But we administer, obviously we perform, and we also donate the iPods to them. We also visit with the residents so that it's not just like dropping off iPods and leaving. We really try to create those long-term relationships and build rapport with the residents by going back to the same homes.
So it strikes me that if you get the funding, that's no longer a constraint, then the constraint to growth becomes the number of students that you can actually get.
Mm-hmm.
Talk to me a little bit about how you go about recruiting. What's the pool of students that you can actually attract?
Sure. So we currently have about 27 active members. We recruit through both the university's First Look Fair and Stamp Fest at the beginning of every semester. And we also hold our interest meeting during the a cappella auditions to try to get the singing crowd too. We also just recruit through other means like flyers, social media, any kind of publicity we can get. And we don't have any sort of audition process. So anyone who has any sort of interest and wants to help out this population is welcome to join.
So if you can get 27 students through that, you want to increase the size, how do you increase either the amount of time a student spends on this or the number of students?
I think a really important part of that is inspiring students. And through going to these senior homes and visiting with them and seeing the impact, we get a more driven executive board and a more driven group. So I think seeing the impact allows students to really care about it more and want to spend time on it. We don't have anything mandatory. It's all just whatever you want to put in, and that's been working for us because our members really are interested in helping this population.
Okay. Thank you.
Thank you. Thanks, Becky.
All right, how about one more round of applause for all three of our Do Good Challenge projects? And now we have the venture category. This is student-created, student-founded, social enterprises, or nonprofits. And the first group up in the Do Good Challenge venture category is the James Hollister Wellness Foundation. Please welcome to the stage Matthew Hollister and Stefano Brun-Urato.
All right, well, my name is Stefano Brun-Urato.
Hi, folks. My name is Matt Hollister. I'll like to begin by telling you a little story. From 2014 to 2015, my father had a year-long battle with brain cancer. After he had passed away, my family was left with a big box of perfectly good cancer medication that we had absolutely no idea what to do with. So as much as it pained us because of my family's waste not, want not mentality, we had to take these medications and give them to a drop-off facility where they were almost certainly needlessly destroyed.
And the problem is that this is not a situation that's limited to just the Hollister family. This happens with people every single day. $5 billion worth of drugs are destroyed every year, and that's just in the United States. These drugs are destroyed in improper ways, like being flushed down the toilet, being incinerated, releasing toxins that harm the aquatic ecosystems of the United States, as well as releasing toxins into the atmosphere.
Just think about that for a moment. $5 billion being used to harm the environment instead of helping people. People like Leslie Fuentes. Leslie is a lovely woman who lives in Honduras with her family. Back in 2014, there was a huge outbreak of chikungunya, a virus very similar to Zika. Unfortunately, one of her children contracted the virus, so being the good mother that she is, she took her child to the hospital where she had to wait in line for hours before seeing the doctor. When it was finally her turn, the doctor had to turn her away on the basis that he didn't have enough medication to give her. The last thing that a doctor should have to worry about is whether or not he has enough medication to give to his patients. Unfortunately, the fact of the matter is, from Afghanistan to Zimbabwe, there's an entire variety of cancer-related, drug-related shortages, from antibiotics to cancer medications. Our waste is their necessity.
And so we created the James Hollister Wellness Foundation. We're a 501c3 nonprofit organization under the federal government, and our goal is to take these drugs that are still viable and useful and make sure they get in the hands of people at home and abroad that otherwise don't have access to proper health care.
Our business model offers a unique solution to the drug shortage problem. First, we test the medications to make sure that they're still viable within FDA standards, both unused and expired medications. Then we relabel the medications so that the expiration date matches the actual shelf life of the medications that we're using. And finally, we donate the medications to our partnered medical missions teams operating all over the world so we can get that medication to where it needs to go. That way, we'll essentially...
Wait a second.
What's wrong, Teo?
So you're saying that we can get these drugs that people haven't used and give them to people?
Yeah.
But then you say we can do expired drugs too.
I did.
Is that legal?
Yes, it is, as long as you're working with the right people who can make this kind of decision to make it happen.
Oh, well, we didn't only just talk
We'll save you the trouble of asking the question. But also keep in mind that we're not exactly pulling this model out of thin air either. We're basing it off of something that the military itself does with their own medication.
The United States military several decades ago asked the FDA, in accordance with Harvard Medical School, to test their drugs that have been sitting in storage for decades and had since expired. What the study found was that 90% of these drugs are still usable for 15 years after they expire. 15 years. This isn't a few days. This is 15 years. And as a result, the military came up with the Shelf Life Extension Program, which essentially is an idea of periodically testing and reviewing the military's medication to see if it's still viable. And so far, the United States military has saved hundreds of millions of dollars by keeping the drugs that are still usable instead of needlessly destroying them.
After a lot of networking, we managed to get in contact with the science director of the FDA. We pitched him our idea, and he was pretty impressed with it. Right now, the James Hollister Wellness Foundation is going through a clearance process so we can talk about our idea in greater detail to other members of the FDA and the military, so we can make our dream become a reality.
And in addition to the FDA, we've probably had more conversations with lawyers than I hope any of you ever have to deal with in your lifetimes. And during the course of the Do Good Challenge, we had our inaugural fundraiser, the Night of Comedy. The Night of Comedy was a great success on January 7th, raising $10,000 from Wells Fargo as well as individual investors.
It's going to take a while to hash out some of the policy-related issues with the FDA, but we're not going to let that stop us from doing some good in the here and now. We've worked with a lot of people. We've used the money that we raised from the fundraiser to fund the medicine and the medical supplies of medical missions teams working in Honduras, Ghana, Bolivia. We estimate by this summer, we'll have served over 11,000 people with the medications that we provided.
With the money that we stand to win today, either $5,000 or $7,500 if we're very lucky, we hope to put the money towards future fundraising goals to be able to compound the spending power of what we have. We figure that we can multiply the $7,500 or $5,000 or whatever we're lucky to win by a factor of tenfold to be able to reach as many people as possible.
This would be huge. It would mean that we can go from serving tens of thousands of people to providing life-saving medications to hundreds of thousands of people. Now, I know we're shooting a lot of big numbers at you guys, and that can be a little dangerous because it's easy to forget that behind these numbers, there are real people who are desperate for help, and we're desperate to help them. Those 11,000 people that we helped may not have changed the world, but it could have changed the world for those 11,000 people. Because the real mission of the James Hollister Wellness Foundation isn't just to save medications. It's to save lives. And that's why we need your help today. Thank you all very much.
Thanks, Matt. Thanks, Stefano. So I guess I have several questions because this was obviously very interesting, but I'll just start with one. The first is really, how do you source the medication? I gotta imagine that you have to have a pretty good sourcing methodology to source from for all these various diseases that you're trying to help and save.
Absolutely. So how the model works currently is that a lot of places and pharmacies and nursing homes and whatnot, they don't actually own the medications that they use. They're the consigners of the medication. So when they have unused or expired medications, they have to do whatever the pharmacy or pharmaceutical company, whatever they say to do. So what they say to do is give it to a reverse distributor where they're most likely destroyed. So we would have to contact the reverse distributor and ask if we can use these medications, and we have, and they said yes, so long as we can get the pharmaceutical companies to reprieve the destroy-only mandate. So that's what we're currently trying to do through networking with the FDA.
Could you walk us through the costs that you incur throughout your process? I'm mostly interested in your testing costs and then the cost of shipment.
In the short term, we've only had acquired drugs that have not expired and shipped them like that. In the long term, first of all, we have lobbying costs with the government. We have expenses associated with traveling, meeting, just standard operational costs. Then as far as testing, storage, and shipping goes, it's a combination of needing to either have a outside facility tested. We've spoken with Johns Hopkins about this, about using a facility and then basically having it done out of house before we move it in-house. In terms of in-house, it's a matter of acquiring facilities and paying people to do that. So you're getting into the 6 figures, 7 figures once we get past all of the hurdles we have to get there.
Okay. So I don't know a lot about buying medication abroad, but how do you think your eventual costs compare to like buying medication directly in another country?
The great thing about what we're doing is that the reverse distributors that are destroying the drugs, the pharmaceutical company actually has to pay these companies to destroy the drugs currently. So it's actually, they're taking a cost, they're taking a hit financially by having to destroy them. So when we acquire them, we're paying pennies on the dollar. We're talking 10,000 pills for $1. There's obscene margins. So if we take these drugs to abroad and sell them or donate them, which we're primarily trying to donate them, they're going to be the cheapest you can possibly find because we have no margins that are substantial in any way.
And it's also important to note that because of the current relationship we have with a few other partnered for-profit organizations, we're able to give our medications away for free. So you can't really beat that price.
Wait, aren't you selling drugs that are already expired? No, I'm sorry, that question was already answered.
Expired.
Thank you. And I ran a
formerly expired.
I ran a boarding school with 1,200 kids. I'll trade my lawyers for your lawyers any day. Talk me through what the implications, I'm thinking about this from pharma's perspective, right? So suddenly you have a ton of drugs in third world countries that could be scooped up by the black market. What's been the response as you work with lawyers and think through this so that it actually gets to the person that you want to help?
That's what we're doing right now, and that's why we're trying to network as much as possible and work currently as much as possible with medical missions teams operating in Ghana and Honduras and Bolivia, like even the Montgomery County's Sister Cities program, and we're piggybacking off of them because they do medical mission trips every so often. And other places that we look into and that we make sure are credible and viable and are really getting the medications to where they need to go, rather than, like you say, so they don't end up on the black market or in some place that would be equally detrimental to society.
And is the idea that they go to the end user or do they go to specific places or clinics?
Depends on who we're working with. Some of the medical missions teams have doctors on their board and they're able to work in the countries that they go to, in which case it would be the end user directly. Others just work with hospitals in the countries that they operate in which case there would be a middleman in between the hospital, but it would still get to the people that they are meant to serve.
Thank you.
Sure. Good. Yeah, great. Thank you.
Thank you all so much.
And now our second venture team, Codactive. Please welcome to the stage Zach Kahn, Tamer Baydar, and Travis Ho.
All right, ready? Yeah. Hi guys, I'm Zach, I'm computer science freshman.
I'm Travis, I'm computer engineering freshman.
And I'm Tamer, sophomore computer engineering. And we are Codactive, and we make coding active. So just take a second and look around you. You're immersed in the world of technology. Whether it's that coffee machine that helps you wake up in the morning, the smartphone that's in your pocket, or even that thermostat. Now, in the next 5 years, imagine what the power of technology could bring, everything from self-driving cars, to flying cars, to even hoverboards. Now, all of these devices work on the computer language of code. And then everything behind all this stuff are the programmers who are able to take an idea from concept to reality. But here's the problem. Only 40,000 people are graduating in the field of computer science each year, compared to 500,000 positions that are available in just the US alone. That's 8% of the demand being met. And that's not only 500,000 problems right now. Imagine the millions of more we're going to need in the future. Now, one thing is that kids are going to be powering the newest technologies. They're going to be ones leading us to this digital revolution. But how are we supporting kids for these amazing futures? Sadly, we're not doing enough. 60% of schools don't even offer a computer programming course. That's not the way we want to empower the younger generation. Now, our solution is to create code-active kids. That is, codactive kids. Kids who are not just programmers, but are problem solvers, innovators, and creators. These codactive kids, with a head start into the world of technology, are equipped to take on even tomorrow's most troubling problems. And that's not just technological problems. Think bigger. Think applying technology to social good. Codactive kids will be programming the artificial hearts and limbs of tomorrow. And the other possibilities are truly endless. Perhaps most importantly, codactive kids have fun while doing it. Now that begs the question, how do we get codactive kids into being? We use our development platform, our learning and development platform, which uses interactive STEM toys, such as toy cars and cranes, and eventually dollhouses and drones, to teach core computer science concepts in a fun way that really sticks. Codactive kids program their devices through our mobile application and go through a curriculum with various modules like the ones you see here that teach them how to take on major problems and break them down into smaller pieces and turn the impossible into possible. Now, that's enough of me talking about how great this platform is. Let's see it in action.
Now, I'd like to introduce one of our most recent codactive kids. His name is Zane, and I believe he has something to show for you all.
Hi, my name is Zane. I'm 10 years old, and I'm in 4th grade. I love technology, and I use it almost every day, whether it's from playing my games to doing my schoolwork. But the problem is, my school doesn't focus enough on teaching technology. After I started using Codactive, my love for technology was satisfied, and it put me a few steps closer to my dream job of being an engineer. Now I have a program that I would like to show you. I would tell you what it does, but I'll just show you instead.
That was awesome. Can we get a round of applause for Zane?
So, that was awesome. But what did he just do? This was the program that Zane wrote. First, Zane just dragging simple blocks into his program, but as he progresses through our curriculum, by the end, he's writing all-out computer programs in a coding language known as Java, which Java is the same code that's running in your Android phones, your desktop apps, and is taught in college-level programming courses. So, nice job, Zane. That was awesome. He's a codactive kid.
Right. So let's talk about how we got here. So we've raised over $6,000 in funding from CG Ventures, and I've worked with serial entrepreneurs such as Parham and Alex of Fusiform, who recently featured in the Forbes 30 Under 30 list. We've also been very busy with the community to gain feedback. We've done focus group testing with the Burgundy Farm Country Day School with both students and teachers, as well as work with the Maryland Center for Women in Computing to ensure that our curriculum meets the needs of students and teachers, and especially young girls who statistically have the lowest engagement in STEM. We've also worked closely with the community school in Baltimore, and they really appreciated the customizability of our curriculum.
Their positive feedback has moved us to incorporate impactful projects into our curriculum. Projects such as coding the car to be self-driving, like all those cool Teslas you guys see on the road today.
So now we've proven, through the community school and through past focus group testing, that our devices can teach programming in a meaningful way. So now imagine if we can bring these devices into the hands of everyone, to individual homes across the nation, entire school districts, even on a global scale. That would be a lot of code-active kids, a lot of innovators, a lot of problem solvers, a lot of filled jobs, and a new generation of people who are technologically adapted for our increasingly technological world. So all in all, we may be young, but we're moving fast. We started this venture only 5 months ago and in less than $5,000. But in that short time frame, we developed a working framework, raised $6K in seed funding, and impacted our local communities. So now imagine what we could do with, say, just 5 more months and $5,000 more. We could go a long way.
Now this summer, we don't plan on slowing down. We're going to be launching our crowdfunding campaign, expanding our curriculum, and growing our volunteer network through a Terrapin-led code-active student organization. Now, with all this under our belt, we're well on our way to creating a technologically advanced future led by the next generation of code-active kids.
Can we get Zane out here one more time?
Can we get Zane out here?
All right. All right.
Another round of applause for Zane. You can head out, buddy. All right.
Amazing. So I have 2 questions for you guys.
Two.
All right. Zane, I'm sure you probably have the answers, so maybe you can stay. So I have 2 questions for you guys. The first is coding languages, and I'm a layperson. I don't know that much about technology. I use it, but my kids clearly use it more than I do. So apologies for the ignorant question. But coding languages, as far as I'm aware, change fairly frequently. Why did you choose Java? So that's one question. And then the second question is, how do you plan to take the product to market?
So one of the reasons why we chose Java is just the nature of Java. The way that the words and the syntax of Java, the way that the code is written, is very easy to understand. It's in really simple English. You get to loop around things. And we thought this was a great way to introduce kids to the level of programming, because there's a lot of languages that exist that seem like random text that's being thrown at the computer screen. Java is, however, different. When you want to move something forward like this car, you actually call something called move forward. And kids can really grasp this easier. And I don't recall your second question, if you could.
How do you take the product to market?
Oh, exactly. So one of our things we're planning on doing is launching our crowdfunding campaign through Kickstarter. This is where we can generate a lot of momentum for Kid Active, because there's a big hype around STEM toys and the way we can transform our kids to become this next generation that knows how to code. So using things like Kickstarter, as well as taking our product to market through Amazon and selling it online, we'll be able to take this not only into online stores, but we also plan on going through school districts. So we want to take this car and this curriculum to school districts. That way, every kid has the chance to be able to learn how to program and get ahead of the curve and design the next generation.
Thank you.
So I'm interested to know why you aren't interested in selling to a toy company. In my mind, getting into a Toys R Us is hard. Getting into public schools in a new state is hard. Why not sell direct to, I don't know very many toy distributors, but a toy distributor, and get your toys in all of the Toys R Us's at the same time?
So that really hits on what we are as a venture. We are not a toy company, we're an educational platform. So really, the reason why we want to take control and have ourselves work with these schools and work with school districts and work with vendors online is because we want to make sure we control our branding and make sure we're not just a toy company, but we actually are focused on the educational impact.
So I guess I'm curious, so as technology becomes more prevalent, my argument would be that those things shouldn't have to, I think they should be able to coexist, right? You should be able to be a well-maintained technology company that also produces toys. So I would say as you grow to think about it, right? I think it's an easy way to scale really fast, and if you have a product that the market wants, I wouldn't close that door.
Mm-hmm. Okay.
So I'm the father of an 11-year-old daughter who's gone through multiple coding programs and games, and everything you did there I've seen before. What's the differentiating factor? How do you differentiate yourself in the market, and what's the cost basis that allows you to do that?
So the differentiating factor is something that you didn't get a chance to see. We demoed what the car can do.
But if you look at the competitors that we have right here, and Zane brought this up to us also when we were talking to him about how he's also engaged with the STEM toy industry. They don't teach you to code. They give you blocks and they tell you to arrange blocks this way, but they never convert you into becoming a programmer. They make you start thinking and get your brain start to like tingle about being a programmer, but then they cut you off. They say, that's the end of our curriculum. There's no more. You're only gonna play a game and this is what you're gonna do. That's not what we wanna do. We wanna gamify things so that we can increase engagement. But at the end of the day, we wanna teach kids how to code. And that's what a lot of these companies aren't doing. They're just setting up games that go along with the toys.
Does it make sense then for you to actually not do the front end and maybe just partner with everyone to do the back end of the jump from the toys to the programming?
That's exactly, but reaching manufacturers at the level that we are right now is very complicated, which is why we are using standard RC cars. Our technology is universal, in which it could be developed on a dollhouse, on a drone, and all of that can be taken onto the Codactive platform. We're using this right now to take our product to the market and get everybody knowing and awareness about Codactive. But in the long run, we just want to develop on the platform of how to teach kids how to code and make it interactive.
Tell me about the financial model then in that. I'm not sure I understand what the margin looks like.
So something we want to do is generate value from existing customers. So that whether that be like new devices that teach new concepts, new packages that teach new languages, this would be so that existing customers can then buy new packages, and that would generate a lot of value from existing customers.
So I'm sorry, let me try to say it back to you. So in other words, the long-term value is that you have the relationship and you're building over time, and so you're actually creating the profit margin as you're selling more.
Exactly. So one of the packages, everybody starts off with learning the Java language. And then as they finish the Java language and they get relatively good with it, then we open up different packages where they can try maybe artificial intelligence in a way that doesn't seem so complex. I mean, you hear words like AI and machine learning, and they all sound like these complex ideas, but in reality, they can be simplified into a much easier way. So these are different ways we can enlighten kids the way they can be engaged. That way they continue with the platform and don't just drop off like many of what happens to kids using our competitors.
Okay. Thank you.
You're out of time, but I have one more quick question. So you may have said this, but can you articulate what does this $5,000 do for you? What does it mean in terms of scale, your growth, your goals?
Sure, I can speak on that. So we want to split a 2,000, 2,000, 1,000 split. So $2,000 you want to spend towards curriculum development. And that's working with experts and key industry education leaders, and really not just developing the curriculum, but also focus group testing, further testing to make sure that students are retaining the information we're teaching them. Other 2,000 would go towards the technology development. So as we're improving our toys and increasing the line of devices that we have, we want to make sure we implement the newest and greatest technology in a way that we can teach complex concepts like artificial intelligence and machine learning in very streamlined fashion. And the other $1,000 we want to dedicate just to community outreach, so that once we have this working platform, really get it in the hands of as many kids as possible and get that outreach working.
Thank you very much.
Thank you.
Thank you.
So as you can see tonight, the Do Good Campus is also an invaluable strategy to recruit young Terps. All right, our last team in the venture category is Symbion Health. Please welcome to the stage Eric Meisner, Mura Chen, and Kyle Liu.
Good evening, everyone. My name's Eric. I'm a current electrical engineering junior here.
Hi, I'm Maria. I'm a pre-medical student, and I work in a nearby emergency room.
Hi, I'm Kyle. I'm a freshman computer science student here.
And we are Symbion Health. Now, just by a show of hands, how many of you in the audience know a loved one, especially someone older who has experienced a fall? Well, exactly. Oh my gosh, very many of you. Well, 8 months, my grandmother had a fall of her own. Luckily, she was conscious, able to pick herself up and get rescued immediately. However, ever since, I kept thinking about the what-if situations, right? What if she wasn't able to get rescued immediately? What if there was no one to help her right away?
Most of us are familiar with Life Alert, the fall alert system famous for their slogan, "Help, I fall and I can't get up." However, them, much like many of our competitors, requires a user to press a button in the event of a fall. However, over 40% of all geriatric falls are due to syncope, a sudden loss of consciousness. So imagine you not only couldn't get up, but you couldn't wake up either. How will you press the button? How will you receive the help that you need? This is why Symbion Health is developing an unobtrusive, automated fall detection device that will know you've fallen before you do and will call for help when you physically cannot.
Imagine this teddy bear here is your grandma. She takes daily medication, which unfortunately has the side effects of dizziness. So one day she's walking down the stairs, she feels dizzy, she goes unconscious, trips, and falls.
Oh, I just got a notification my grandma fell. I'm coming, Grandma.
So our device notifies you when this happens, but that's not all. We also have an online patient platform which allows you or your primary care physician to get real-time diagnostic information before your loved one even gets to the hospital.
Now, what we have right here places well in the current competitive landscape. With a mobile app, our product works anywhere you go. Unlike our competitors that only operate within your home. Also, we are cost-effective in developing a wearable device that seniors are actually going to want to wear. Lastly, we are the only device on the market that has an automated fall detection system. Now, this all started back in October when we received a Do Good Seed Fund, and since then we have progressed with great momentum. We have prototyped a working product that Kyle has just demoed, and Symbion Health has established strategic connections with the School of Engineering, which helps us to develop the device itself. We have partnered with HCR Manor Care. I know you know HCR Manor Care. We have partnered with them and conducted over 50 stakeholder interviews with patients, their loved ones, and doctors and geriatricians. And finally, we're excited to announce that we've been accepted to the MedStar Innovation Institute, a 7-hospital system in the greater DC metro area. Thank you. And we are excited. We did this all as a true do-good venture, receiving seed fund coaching, enrolling in a do-good course, and attending all do-good challenge-related events. Now, so far we have a working, patent-pending, minimum viable product. But we want to develop something, right, that seniors are actually going to want to wear. So the general consensus was that current devices are bland and ugly, and elderly people just don't want to actually keep it on. That's why at Symbion Health, consumer-centric design is the sole initiative of the company. Through our partnerships with MedStar and Manor Care, we already have patient populations ready for testing. So $7,500 from the Do Good Challenge would expedite the whole process to this refined design. Lastly, this summer we have been accepted into the Digman Center's incubator program, Terp Startup, to continue this whole system of product testing and product development. Now, honestly, the opportunity here is huge. It's massive. Each year, 2.2 million unconscious falls occur among seniors in the United States, and 800,000 of those falls are seniors living independently. This market is only going to continue to grow as 10,000 baby boomers turn 65 every day. Finally, globally, the total available market increases exponentially.
Every 4 seconds, someone over the age of 65 experiences a fall in the United States alone. That means that just in the 5 minutes we spent speaking to you all, roughly 75 people have fallen around the country, and statistically, 40% of them are unconscious. So not only are there 30 grandparents, parents, aunts, uncles, brothers, sisters, or friends who are on the ground, but there's also 30 family members, much like yours or mine, that has no idea that our loved one is in danger. This is why falls are the leading cause of death among the geriatric population, and this is why Symbion Health is devoted to accelerating rescue and saving lives every single day. Thank you.
Thank you guys very much. It's very impressive and a very ambitious plan that you have there. So I guess one of the questions that I have is just really around how you prevent copycats. So as you can imagine, for wearable devices, you know, starting from Fitbits to Apple Watches to, I don't know, Fossil has a wearable device. How do you prevent a copycat from taking this technology? Do you plan to be the go-to-market on the actual wearable, or do you plan to license that technology to wearable companies?
So we want to be the actual wearable manufacturer. You want to be an OEM, original electronic manufacturer. The reason that we think we can displace Apple Watch and Fitbit is because they know so much about the millennial generation, but they have not taken the time like we have to go to elderly homes, nursing homes, and prototype with geriatric patients, right? Something that grandma's actually going to want to wear. And that's really what we think is a big difference.
And what is that they want to wear? Like, what does that look like? What what does it feel like for them?
Sure, so my grandma, she didn't have her life alert on. She had a life alert and she didn't have it on because it was like too bland and too boring, really. And the thing is that there's a social stigma around these devices themselves, so that she didn't want other people at the retirement home knowing that she needed it, right? So the way we're gonna do it is make it as micro scale as possible. So at first we're gonna embed it in like in jewelry, right? Something that your grandmother already wears. But we also wanna make it so small that it can be placed in belt clips, clothing, and like even machine washable with silicone warping, so that like it can't be seen. It's completely unobtrusive.
And you're not afraid that this population loses it very easily?
Loses it very easily?
Loses the device very easily.
Yeah, sure. So, well, with the case there is that we wanted to keep it, we want to make something so that it is always on you, like something that's embedded in clothing. But honestly, our price point is so good that if you lose one, you can buy like 3 of ours compared to 1 Life Alert. Seriously, Life Alert is so expensive. It's so expensive.
Okay.
Yeah.
Thank you.
Yeah. I mean, it seems like you've identified a clear hole in the market, and I'm going to ask you the question that I imagine a lot of other people have asked. Why does this hole exist?
we're expecting the false positive.
Yeah. Well, this hole exists because, like we said, many of our competitors, it's out there, but they require the user to press the button. But I guess they don't realize that many of these falls are from syncope, over 40%. And another big target population are people with Alzheimer's and dementia who, they might be conscious, but they might not remember that they have to press the button. And there's falls, there's devices who consider this, but like we said, upon interviewing many people, we realized that it wasn't just that the device wasn't working, it was that they didn't want to wear it because it was ugly and that they didn't want everyone to see it. So this is the only one that's like micro scale and automated.
And also the current other products like Philips Lifeline and Life Alert are so ineffective, they have other problems to deal with before they try this fall detection. Seriously.
I'm not sure I understand why you want to get into 3 or 4 markets where you have absolutely no ability to play at scale and just play in the one market, which is your actual product, and figure out how to license it. And so take me through the analytics or the rationale for why you want to get and fight against the Fitbits and the Apples of the world, as opposed to just license a patented product that provides cash flow.
Sure, so of course we're going to keep that option for licensing open, but right now Apple Watch, Fitbit, Huawei Wear, Android watches, they're getting away with insane profit margins.
Sure.
I've gotten quotes from Qualcomm Industries in the United States, STM Microelectronics in China, all these original device manufacturers where you send your schematic and they give you a motherboard back. It's only going to cost $17 to make this at
What's the cost of marketing in that game?
Cost of marketing in that game?
What's the cost of marketing?
Life Alert spent about $10 million throughout the United States for their marketing campaign. But honestly, if we had something good, with a great price point strategy, we want to market something that's going to completely displace the products already out there.
And just through like a Google ad campaign, we were able to get, which costed like, it was very inexpensive. We were able to get like 10,000 website views and like thousands of newsletter signups. So people are searching for this and people are like interested.
Okay, thank you.
Thank you.
And now I'm going to ask our judges to retire to the green room to select the winners. And I want to say personally, I'm glad I'm not one of you. I also want to say that if you think about the 6 Do Good Challenge finalists we saw tonight, it's clear that we are on the path with the Do Good Campus to create a generation of Terps that will be motivated and equipped to do good for a lifetime. And now, my friends, as I said before, it is now time for the Be Sauce, Be the Solution Audience Choice Award. You will get to choose with your vote for one team to win $2,500 from the Audience Choice Award. Now, I want to remind you, you're only getting one vote, all right? So Choose carefully, and the codes to text to vote will appear on the screen. All right. Don't worry, they'll be up there for a little longer while I'm giving you a little information about what our next vote is. Now, earlier tonight, if you could make it through the mass of people, you were able to vote with your do-good dollar at the Do-Good Showcase for promising do-good teams and do-good semifinalists. And we added up the votes, and there are 2 teams that will get the opportunity to make a lightning pitch for their project right here on the stage, and then you will get to vote, and the vote winner will win $1,000 for their promising do-good effort. Please welcome to the stage our first Do Good Showcase finalist, Sarah Dudley of Nourish.
Imagine you are a pregnant woman and you walk into a food bank. You're given a can of sliced carrots, a can of beans, and a box of pasta. I doubt you'd be able to make something appetizing, let alone a nutritionally whole meal for you and your baby. That is where we come in. Team Nourish is a group of students who create healthy meals to deliver to pregnant women on a weekly basis. We established a partnership with the Pregnancy Aid Center, a nonprofit maternal health clinic right down the road in College Park, and each week we create Nourish boxes. Our Nourish boxes are full of all of the ingredients and recipes necessary to create 3 healthy meals for a mother and her baby. Our goal is to educate and provide the resources necessary for pregnant women and new mothers to grow a healthy baby. The way that we do this is we provide both online and paper resources to educate these women. And then once we deliver these boxes, we give them the meals and recipes to create a healthy cookbook with all of the information they need. To date, we are creating these boxes at an $8 expense to us. Originally, this was a $15 expense to us, but we are still delivering them for free to the Pregnancy Aid Center. So far, in the 7 weeks we've been working on our project, we have delivered over 100 meals to women in need. And this is just a starting point. We were recently approved to become a student organization on the University of Maryland's campus. This will allow us to continue holding delivery days through the summer and well into the following semesters. And this is how the Do Good Challenge winnings will help us and how you all can help us. With the $1,000 winnings, we would be able to create a minimum of 375 more meals to deliver to the Pregnancy Aid Center. This would allow us to maximize the impact that we have on the College Park community. I thank you for your time and consideration, and for your votes, and for helping us to help babies.
And our second showcase finalist for their lightning pitch, Seth Mitchell of Running Water.
Hello, my name is Seth Mitchell. I want you to think about how many gallons of water do you think you use every day? 10, 20, maybe 50 gallons? Well, the average American actually uses 101.5 gallons every day. Now, I want you to think about how you access that water. The shower heads, faucets, and other things you use to access this water. If those weren't there, could you imagine what it would be like to have to carry all of that water every day? Well, this is the reality for 663 million people all over the world. Women and children spend an average of in all of Africa and Asia, spend an average of 6 hours walking 3.7 miles a day to collect an essential resource like water. This activity is costly in time and keeps them from taking opportunities to get educated or employed. And how we chose to tackle this issue, in addition, 50% of the world's hospital beds are filled with people suffering from waterborne diseases. And so these people are spending hours of their day collecting an essential resource that's ultimately doing much harm to them and their families. How we chose to tackle this issue is by creating a 3.7-mile race that simulates the water collection process. These participants go, this distance, collect a water container sized to their ability, and bring it back, and their race registration fee goes to help another person in need. We hosted the race this year, and were able to help over 60 people get access to clean water, in addition to raising over $1,800 in funds. We hope to scale and we're not stopping there. We hope to scale our organization to 5 other campuses in the coming year and help over 350 people gain access to clean water. And we need your help to do it. So please vote for us and help us to go the distance in changing lives. Thank you.
And now I should mention that just for getting on the stage, one showcase winner will win $500, and the top voter getter will win $1,000 for their team, for their Do Good Showcase audience prize. And now we're going to put up their 2 text to vote, and you have to choose whether you want to vote for team number 1, which is Nourish, or team number 2, which is Running Water. All right. Now we're going to have a short interlude while we prepare a short Do Good Campus Pioneers panel. All right. While our judges are deliberating, I'd like to welcome 4 Do Good Campus Pioneers. I will introduce them a bit more as I get to ask them questions. But first, I just want to introduce Sagar Doshi, Khalil Kettering, Dana Priest, and Jay Smith. Sagar, I'm going to start with you. You were actually on this stage 3 years ago when you won the Do Good Challenge with Students Helping Honduras, a group that engaged hundreds of students in building schools in that country. But something someone might not know about you is that you also majored in finance, and you created your own major in social innovation. Now, as part of our Do Good campus, we have in the School of Public Policy a new major in public policy that includes a focus on social innovation and nonprofit leadership, and we're also developing a minor in that area. So I'm curious, what's 2 or 3 things important lessons you learned from that minor in social innovation? And how is it influencing the work you do now at Deloitte, focused particularly on higher education and sustainability initiatives?
Yeah, absolutely. We're really happy to be back here. I'll tell you, it's a lot easier to be like just sitting in the audience than actually pitching. I was not nervous at all, just sitting here. And that new major and minor sound amazing. I feel like every year I'm away from graduation. I graduated back in May 2015. It's like another new program, new initiative. I'm like, wow, I wish I could have had that, when I was a student here. I would say in terms of some of the major lessons I've learned from the courses and the major that I've really created, one of the big ones that really hits me home is that you can really do well, like financially, and also do good, even after you leave college. So currently I'm at Deloitte Consulting. I've done some higher education consulting work. I'm doing a sustainability analytics project, and the choice I had to make when leaving college here wasn't that, oh, should I go work for a nonprofit? What's the deal there? I have student loans. You really can go out, work for corporate America, if you want to say so, and still do good and do well at the same time. I think that's one of the big things a lot of us students struggle with. We're like, okay, it was fun in college, but I think after college, it's very viable, and I've really enjoyed my experience. And I want to say the second lesson I've learned through some of the courses that really the Do Good network here on campus really provides you is a lot of these courses are very discussion based. So, you're in a conversation, you're in a circle. I've been in Grimm's courses. You're in a circle, you're discussing, you're kind of thinking through the thought process. And I think the adjustment from school to real world, a great example is I was on my first project, my manager was like, this is what I need you to do. I'm like, okay, awesome. How do I do it? What's the end result? He goes, that's why I hired you. And I was like, oh. So I think college and some of these courses really having more discussion based, they make you think through the logic, and I think that's been really helpful in the real world.
All right, great. Dana Priest, I want to ask you the next question. You assigned a research project in a class a couple of years ago to research journalists who are imprisoned abroad. From that project, you inspired a group of students who created Press Uncuffed. They won the Do Good Challenge. They developed partnerships with groups from the New York Times to HBO, and they've been credited with helping free numerous journalists abroad. The Do Good Campus is about faculty and students working together to make an impact on a cause. Could you share a little bit about how were you able to turn Press and Cup from, say, inspiration to action? And what were a couple of the key things you did as a faculty member to make it so successful?
Well, I've been a journalist all my life at the Washington Post, and so that was the first year I actually tried to teach. And I thought, you know, the only thing I really want to do is to get students to understand the power that you have as a journalist, the fun that it can be, and how much of the world you can explore yourself that you don't already know about. So when I created the class, I thought, and I also do it in the national security world, so how in the world am I going to teach students that? So that's where I came upon the idea of making a big problem, which is press freedom around the world and journalists who are killed or imprisoned for what they do, into an individual issue by giving each student one journalist to do a profile on. So that already, over time, got them attached to a person while they were learning about, frankly, countries that they, in the beginning, didn't even know where they are. Azerbaijan, Kyrgyzstan, some, you know, not the biggest countries in the news, but unfortunately, jailers of journalists. And that worked. But the second thing I did in the class, which I think students really, by the time they came out of it, were really bonded to the class and to the mission, was I had really high expectations for what they could do. Things that they, when I asked them to do it, they looked at me like I was crazy. And just to give you an example, you know, I told them in the beginning that they would be learning how to interview a former U.S. ambassador to, you know, Egypt or Turkey, whatever their country is, and also experts in their country, and they would learn how to reach out to countries overseas, to the colleagues and the family members of these imprisoned journalists, and to the officials. And so again, they were sort of saying, what? And that all happens in the class. And the big secret is to make them understand that confidence can get you so far, and that even if you don't have confidence, I'll say this in the kindest way I can think of, a lot of it has to do with bluffing your way through. And I don't mean lying or exaggerating. I just mean that, you know, adults don't have the answer to everything they're doing. They just might look like they do because they've learned how to do that. And so we've done confidence practices. You know, how do you call a U.S. embassy overseas and get put through the operator to the press person without them recognizing that you're actually kind of a nervous student, never called an embassy before? But there's a trick to this that it's not hard to do, and we practice it, and they did it. So I think in the end they were really proud of themselves, that they reached out. Some of them actually did jailhouse interviews of the journalists in prison in Turkey, for example. They were very proud of the product that they produced, and they did it through a person whose relatives and whose colleagues they had gotten to know through the reporting. So the last thing that first class wanted to do is just walk away having completed their journalistic research.
Great. I really appreciate your inspiration and your support for that effort. Khalil, 1 out of every 10 jobs in the private sector is actually with nonprofits. It's not a well-known thing, but part of the Do Good Campus is also creating a new generation of nonprofit leaders. You actually decided to come back to school, get a graduate degree where you focused on nonprofit leadership and management, now work as an urban director for Maryland and DC at the Nature Conservancy. Now, you did hands-on projects, I know, from India to actually working with nonprofits right here in Prince George's County. Can you talk about what's a couple of the important lessons you learned about how to be an effective nonprofit leader through that education?
Sure. First of all, it's an honor to be here. I gotta say, the competition you had up here blew me away. I mean, that was amazing. Yeah, a round of applause for them. Also, I'd like the record to show that this means that Bob is calling me a leader, a nonprofit leader. So I hope that gets noticed. I think the first thing is to always be prepared. So I got some notes here. But there's a couple of things that I took away from that. Number one, combine strategy with passion, right? You know, you can be passionate about something, but if you're just passionate and don't have a strategy, you can't get very far. You can just be spinning your wheels. But a strategy without passion is not genuine, and people can tell that. Combining the two of those can be one of the most powerful forces to get something done and to have impact. Number two, the ability to think micro and macro scale at the same time. Focus on your project, what it is you're trying to accomplish right now and right here. But at the same time, you heard a lot of the questions from the judges. How do you scale it up? What's the long-term end game? What's the big picture about this? So thinking micro and thinking macro is very important, and being able to do both of those at the same time takes a lot of energy, but is a very important skill. The importance of human connection, as we're getting into a world that's more and more connected digitally, we sometimes forget about that relationship, that raw relationship, and the power of that relationship that you can build, and that power of story. And stories become numbers, but then numbers tell a story. And if you heard, again, a lot of the questions, there was a lot of stories here, the power of those stories. My grandmother, my father, that draws you in. But then the questions are, well, what does that mean for these $5,000? What are you going to do for X amount? Being able to take those qualitative stories and turn those into quantitative numbers is powerful. And that's how you're able to get supporters, and that's how you're able to bring in more resources to drive whatever it is that you're trying to do forward.
Thanks, Khalil. And I think, in case you were wondering, I will approve you getting your graduate degree. This is a long-term joke with Khalil and me. But my last question for our Dewey Campus pioneers, my individual, is to Jay Smith, who's been leading an Honors College Innovation Entrepreneurship Program. And I'm pretty certain that in the last 5 or so years, a current student or alum of your program has been involved in at least one Do Good Challenge finalist.
Pretty much.
And Jay has been a leader in creating all kinds of innovative curriculum around social impact. He creates things called the Gumball Challenge, Terp Tank. And so one of the things I want to ask you, Jay, is, we want to create more faculty who are infusing Do Good into their programs and courses. What's your secret? What is it about your curriculum that's led to current students and alums to create efforts that make a social impact?
Thanks, Bob. I think what the challenge does for our program, for our students, and for our curriculum is to take what we're teaching and trying to get across to the students and make it real and make it personal. We get amazing students coming into the University of Maryland, top students from all over the state, New Jersey, my home state. So anybody here from Jersey? All right. Exit 105. And we even get, they're leaders, they're passionate. It's just wonderful to bring them in. And this is a way that we can take them through our kind of 4-course curriculum, helping them to tease out their passions, their talents, their interests, marry them with problems that are out there in the world, social, environmental, give them the tools and the coaching. I want to shout out to Ryan Elza, who's one of our staff who's out here, social entrepreneur himself, to do that. And it helps them to really kind of take these ideas that may be abstract and really go out there in the world. One of the key things that's been going on in entrepreneurship education, and I think we're going to even get more great students coming in with the Do Good Campus, is that you have to go out and test your hypotheses for your ideas for your businesses. And so basically what we've been able to do with the Do Good Challenge is incorporate that as our kind of customer and market verification and validation for their ideas, to get out of the classroom, go out and talk to the people, which we've heard is a challenging thing for students, challenging thing for adults, to talk to strangers that you don't know, even when you're just learning about the idea yourself. And so I think that's a key thing to whatever discipline you're in, just whether it's journalism or other disciplines, public policy. We have students coming from engineering, from business, from public policy, from all over campus, from BSauce, a shout out to BSauce here, to go out and actually experience what the real world is and get real feedback.
Now I'd like to ask, kind of just like the showcase lightning round, I want to ask each of you, because you all are pioneers that have really done efforts, led efforts that have created the Do Good Campus that we launched this year. What's one most important piece of advice you'd give others about going out and doing good in the world? Sagar?
Yeah, I would say stay committed. Even if it's post-college or during college, it's hard sometimes. Sometimes there's not 100 people at your fundraiser. Sometimes there's 2, and it's your exec board. But you have to realize that you have to stay committed. It's really hard to, for as many of the highs you see here, there are lows for these organizations, but I can't stress the importance of staying committed.
I'd say partnerships. At the end of the day, we can do more together than we can alone.
And I would say building sources is the language I would put it in, but for a non-journalistic audience, building networks, and networks rely on personal relations, so you need to know how to talk to people, not just send emails.
I'm going to say something maybe we shouldn't say on this campus, just do it.
Just do it.
Now is the best time to be starting something and doing it. You have the freedom, you've got the resources here of faculty, other students, places like the Do Good Institute, the accelerators, at Dingman, at MTech, all over campus. It is a great time. Don't wait now. You can have a real impact while you're here on campus.
I think that's a nice way to close with the Do Good Campus and doing good. Just do it. All right? How about a round of applause for our Do Good Campus pioneers? And now, my friends, it is my pleasure to welcome back our judges, and we're eagerly awaiting their decisions. Please welcome back Kirsten Kraft, who will be starting with the BSOS Be the Solution Audience Choice Awards.
Hello. Wow, so we had a hard time making our decisions, and I am so thankful that I was on the other side of the table that time and that I wasn't competing. It seems like you all may have had a hard time making up your minds as well, because for the first time in Do Good history, we have a tie for the Audience Choice Award. I know, right? Crazy. I'll wait till they get on stage. All right, so a big round of applause to our Audience Choice Award, the James Hollister Foundation, and Symbion. So because there was a tie, you will both be getting $1,500. So still a good chunk of change, right? Now I want to give a huge shout out to everyone that participated in the showcase. I know the Do Good Challenge is obviously a very competitive event, but I hope you all got a chance to check out all of the awesome contestants who also competed in the showcase. So first, I want to give a shout out to our runner-up, which was Running Water. And for those of you who missed his table, just a little bit of background. So Running Water organized a race where they tried to simulate what it's like to live in an environment where you have to walk to get your water every day. So contestants had to get their own container, and they filled up the container with water, and then they carried the water for a portion of the race. Cool idea. And for the winner of the Audience Choice Award, it went to Nourish. And so I missed this table, but I was told this is a combination of Blue Apron and babies and moms and healthy and like major discounts, so that sounds like a great idea. Way to go. Now I would like to bring Charisse up so she can announce the winners of the project category.
Thank you guys so much. I guess I'll first just start out by saying on behalf of Morgan Stanley, it was my
extreme pleasure to be here with you all today. So every day I have to sit in front of a committee, and I chair a committee where I ask people lots of tough questions, but today was very pleasurable in being able to meet really young and talented do-gooders and social entrepreneurs and entrepreneurs who are thinking about really interesting and innovative ways to make a major impact on our society. So thank you all for your hard work and your dedication, and it was my pleasure to be with you today. So that brings us to our project winners. And just as a reminder, the project competitors were Preventing Sexual Assault, Vintage Voices, and Terp Thon. And this was a very difficult decision. There was a lot of deliberation in the green room. The third place project will go to Terp Thon. So ladies, you obviously have the spirits and the hearts and minds of the campus with engaging over 10% of the college campus in your events, and we thought that was really amazing and super impactful. And so you're clearly a culture carrier and a leader as it relates to being and what it means to be a Terp. So we thank you for that. We would love to hear more from you over time on how you really measure the value of the marginal investment. So if we invested with you, or as we invest with you in this third place slot, how you're really going to use that to really drive your growth, because you have achieved such amazing success thus far. So thank you so much. And our second place project prize goes to Preventing Sexual Assault. As a board member of a domestic violence survivor organization, which obviously sexual assault is definitely a part of what afflicts those victims every single day, I was very moved by your stories, very moved by the presentation, and importantly, we really felt like you have a very implementable business plan, and you also have very clear measurement of success. We'd also love to see from you over time just a clear articulation of how you're going to spend the dollars, and we hope that you use this money to continue to expand and scale the PSA across college campuses nationwide, and we'll be cheering you on from the sidelines. So thank you for that, ladies. And obviously, our first place winner goes to Vintage Voices. Very, very, very well deserved. Congratulations to you and to your colleagues and your fellow singers. This is obviously a very innovative idea. You've hit all the criteria of the things that we were looking for, from impact to improving the lives and the well-being and the mindfulness of our most precious one of our most precious populations, the elderly population, to having a creative idea, to having something that's truly leverageable and obviously feasible. We thought that you hit all of our criteria right on the head. One of the things we want to see you focus on as you think about spending this precious $5,000 is really thinking about how you're going to acquire an army of volunteers to double your outreach. So we'd love to see you spend some time thinking about that. Thank you. So congratulations to all the project winners, and now I would like to welcome Raj Vinakota to announce the venture winners. Thank you.
So when I was 23, I came up with this crazy idea of starting a boarding school for inner city kids. And when I was 25, I left my job as a management consultant because I thought it was the right time to do it. And at the age of 27, we opened the nation's first urban public boarding school called the Seed School of Washington, D.C. And for many, many years, people would say, Raj, Eric, what were the characteristics that allowed you to pull this off? And we really kind of got it down to two pieces. we were naive, and we were stubborn. And so I wish all 3 finalists years and years of naivete and stubbornness as you go on to grow your ideas into the future. And congratulations to all 3 of you for today's presentation. We'll start off with the 3rd place venture, which is Codactive. Congratulations. We thought the idea itself was great. The idea of bringing a 10-year-old on stage was spectacular. We wanted to see more clear differentiation from the rest of the market, and whether there was a possibility to partner with others who were already in the market so that you could use the value added to really get to scale. But there was a great idea there. And we think that figuring out exactly how you enter the market and then expand is going to be the key question for the Codactive team. So congratulations. To the 2nd place winner for the ventures goes to Symbion. Congratulations. Just an incredible, innovative product idea that's been put together. The big question that we had was that we weren't sure whether the plan to go to market again was the right one. That the cost of marketing might be high and there needs to be more research done around that. And would there be a possibility to actually do it in partnership, since there was an incredibly great product that was in the process of patenting, so you could protect that, but how do you actually go to market in an effective way? And so that's the thing I would ask you to think about next, and congratulations to Symbion. Which leaves us with the 1st place venture, the James Hollister Wellness Fund. So maybe all 3 of the judges should be in the venture capital or angel fund game, because we all saw this as the highest risk, highest reward investment possibility in terms of our venture. Everything that you do rests on being able to figure out this legal issue and figuring out this financial risk that you have. But we think that you can figure it out, and when you do, you're going to have a spectacular reward on the back end. And for that, we give you the 1st place venture award. So congratulations.
And that, my friends, concludes this year's Do Good Challenge. I'm sorry, that was my daughter. And if I do say so myself, I think the first year of the Do Good Campus, it was a great success. And come back next year, because we've got even more exciting times and exciting ventures and projects where students are doing good here and around the world. Thank you very much, and have a good night.